Howdy! For this video microlesson, we will be covering attention deficit hyperactive disorder and the consequences of ADHD stimulant medication prescribed during adolescence. The contents of this presentation were composed by Braylee Beckham, Andrew Carey, Teresa Coe, and Alyssa Gallardo. This presentation will be covered in 3 segments, with the 4th segment being resources we used for our research. For the first segment, we will be covering the introduction to ADHD. Then for the second, we will be looking at research gaps in adolescent demographics. Then the third being consequences of the stimulant intake during adolescence. First, let's start off with what ADHD is. According to the American Psychiatric Association, attention deficit hyperactive disorder, also known as ADHD, is one of the most common mental disorders affecting children. Common symptoms of ADHD include inattention, which is not being able to keep focus on a task, hyperactivity, which is the excessive movement that is not fitting to the setting, and impulsivity, which is hasty acts that occur at a moment's notice, without thought. Here are some statistics on ADHD. About half of the children ages 3 through 17 currently take ADHD medication. 2 out of 5 receive behavioral treatment for ADHD in the past year. About a third receive a combination of ADHD medication and behavioral treatment in the past year. 1 out of 6 have only received behavioral treatment for ADHD, and about 1 out of 3 had not received medication or behavioral treatment. Now we'll be moving on to segment 2, which is research gaps in adolescent demographics. Many of the common questions asked in ADHD research are: who are the stimulants treated to? What type of medications are approved by the FDA? What age groups are being treated? Below each of these questions is the answer to it. Although these questions have been answered, there are still many gaps in research. The following slide will go over a few gaps in that research. The first research gap we will be looking over is adult versus child reactions. Children respond differently to drugs than adults, not only regarding the anatomy and physiology, but the different cognitive effects and the types of additional diseases present. To solve this issue, some key differences should be taken into consideration when giving adult drug doses to children is body composition, organ maturation, and metabolic processes. In early childhood, there are rapid changes in body proportions, water content, and major organ systems that affect drug elimination and absorption. The second research gap we'll be looking at is ethical differences. Informed consent and risk-benefit assessment should be carefully addressed when conducting research with children. To address these ethics, parents should provide permission, the child should have adequate cognitive ability to agree to participate, steps should be taken to minimize discomfort, fear, and anxiety of the child. There should be place a limit on blood samples per individual, and forms of age appropriation medication such as pills or liquid. For the final research gap, we will be looking at differences of response of children to adults. First, what is their response? Side effects include idiosyncratic or toxicity reactions, effect of drug dose or concentration in plasma, if the response is overt or covert, quick or delayed, temporary or permanent. Children are also prone to other mental health conditions such as oppositional defiant disorder, learning disorder, anxiety, and depression. In the last segment, we covered research gaps in adolescent demographics. For the third and final segment, we will be covering the consequences of stimulant intake during adolescence. Below is an example of a study that highlights these consequences. In the study conducted, methylphenidate exposed during adolescence dysregulates second messenger signals in the prefrontal cortex. The study was designed to investigate if methylphenidate, a commonly prescribed stimulant for the treatment of ADHD, affects second messenger signals within the prefrontal cortex across various adolescent ages of mice, and if treatment would result in sex differences. Findings found in the result of this study showed exposure to a clinical dose of methylphenidate during adolescence causes changes in mRNA expression within regions of the prefrontal cortex that are implicated in mood-related disorders in adulthood. The takeaway from this study is that there are long-term behavioral consequences of methylphenidate. Here is a list of our resources. That is it for this micro lesson. We hope you were able to learn something, and thanks for watching.